Welcome to our video about the ingredients of a safe teeth whitening product. If you're looking to whiten your teeth without the risk of damaging your enamel, you need to know the ingredients of a safe teeth whitening product. This video will cover a few of them, including activated charcoal, sodium hexametaphosphate, and carbamide peroxide. Those are the most common teeth whitening products used, but there are other whitening solutions available as well. Let's look at the best one. Activated charcoal. You may have seen ads for whitening products containing activated carbon, but you may be wondering if it really works. This substance has a few positives and some negatives. It isn't a teeth whitening agent, but it does absorb toxins from the mouth. While it can whiten the teeth if used correctly, the long-term effects of using charcoal on your teeth are unknown. You can brush your teeth with activated charcoal or use it as an implant. However, you should always be careful if you plan on using it on your teeth. The immediate results from charcoal can be temporary, and discoloration over time will be permanent. This happens because the enamel is eroded. It may also damage other parts of the body, including your gums, bones, and teeth. The whitening effect of charcoal is temporary, so you should only use it if you're sure you're going to have an upcoming event. When used as a whitening agent, charcoal can help whiten teeth by absorbing stains. However, it can be abrasive, and using non-dentist approved charcoal toothpaste and powder can lead to enamel erosion. When your enamel is worn down, it will expose the yellowish dentin underneath. It's important to follow directions carefully to avoid causing harm to your teeth. Aside from whitening your teeth, charcoal can also be an effective way to strengthen your teeth. Activated hydrogen peroxide. A recent study shows that higher concentrations of hydrogen peroxide are more harmful to tooth enamel. The researchers also noted that prolonged exposure to peroxide is harmful. Once damaged, the tooth enamel cannot be replaced. In order to avoid adverse effects, hydrogen peroxide should be used in low concentrations and should be purchased from a brand with the ADA seal. The duration of treatment also plays a role in the adverse effects. The effects of 35% hydrogen peroxide on the enamel surface were not significantly different. However, the treatment with cold light did not seem to significantly alter the crystal size and color. Unlike other bleaching agents, the acidic nature of the solution reduced the crystallinity of the enamel, resulting in increased sensitivity and tooth loss. In contrast, the treatments with home-based hydrogen peroxide caused no significant changes to the tooth structure. In the meantime, you can make your own hydrogen peroxide paste by mixing equal parts of water and hydrogen peroxide. Apply the paste to your teeth for 2 minutes and rinse thoroughly afterward. Some people make homemade whitening strips using peroxide paste. These strips are usually made by coating coffee filter paper or foil with peroxide. The peroxide is held onto the teeth for longer periods of time. This method may increase tooth sensitivity and gum irritation. Activated carbamide peroxide. Activated carbamide peroxide is a popular choice for safe teeth whitening. This type of peroxide is higher in strength than hydrogen peroxide, which is what most at-home teeth whitening kits contain. The ratio of carbamide peroxide to hydrogen peroxide is 1:3. A typical 10% dose of carbamide peroxide is equivalent to 3.6% hydrogen peroxide. When applied to teeth, carbamide peroxide remains active for about 2 to 6 hours. While hydrogen peroxide is still considered the best option for whitening teeth, many people find carbamide peroxide a more convenient and safe option. Because carbamide peroxide breaks down stains and is less concentrated than hydrogen peroxide, it releases its whitening effects more slowly. The only downside is the longer duration of effects, which makes these whitening formulas less suitable for at-home teeth whitening. Some studies have concluded that hydrogen peroxide causes a range of adverse effects in humans. Some patients may develop sensitivity to air, hot, and cold. It is not clear how much of a risk carbamide peroxide poses to humans, but over-the-counter whitening products usually use trays that overlap the gums, which can cause gum infections. Other side effects include air and thermal sensitivity, which is an uncomfortable sensation when breathing or eating. In addition, these products can dehydrate living tissues and cause tooth sensitivity. People with a history of sensitive teeth are more susceptible to these side effects. To reduce the risk of tooth sensitivity, they should take nonsteroidal anti-inflammatory medications. The best way to ensure safe teeth whitening is safe for your smile is to consult with a dentist. The dentist will be able to recommend a safe teeth whitening solution based on your needs and budget. They will also be able to prescribe an at-home whitening product and give you advice on how often you can use it. When it comes to choosing a whitening product, it is best to use a whitening gel that contains less than 10% carbamide peroxide, which is not suitable for everyone. Aside from being safer, carbamide peroxide can also be more effective in lightening stains and brightening your smile. Sodium hexametaphosphate. Sodium hexametaphosphate, a common ingredient in whitening toothpaste, is safe and effective for teeth whitening. This ingredient is derived from a variety of natural sources and is found in many kinds of toothpaste. However, there is some controversy surrounding the safety of this ingredient. Some studies have suggested that it may cause allergic reactions in some people. It should be noted that most studies on this ingredient have focused on its safety for use on teeth. It is the most common friction agent used in whitening toothpaste. It is a very stable chemical with moderate hardness, uniform particle size, and a smooth surface. It is compatible with fluoride and has excellent antibacterial properties. Other chemicals found in whitening toothpaste include surfactants, chelating agents, oxidants, and enzymes. Sodium hexametaphosphate is a form of sodium tripolyphosphate that inhibits the growth of dental plaque. It has an affinity for hydroxyapatite, a mineral that forms on the surface of tooth enamel. Sodium hexametaphosphate has a desensitizing effect on dentin, making it easier for a colorant to discharge. In this study, sodium hexametaphosphate was combined with a standard sodium fluoride toothpaste. The treatment was conducted for 8 weeks. The study used tactile assessment using the Apple probe, thermal assessments using the Schaff Air Index, and oral soft tissue examination at baseline, week 4, and week 8. Sodium pyrophosphate. The ingredient sodium pyrophosphate is known to be safe for teeth whitening, as it inhibits the formation of an important mineral found in tooth enamel. The mineral is hydroxyapatite. Sodium pyrophosphate is used in teeth whitening because it is effective at eliminating deposits of proteins and other materials that make up the pellicle coating of the tooth enamel. Sodium pyrophosphate is an inorganic compound composed of diphosphate and pyrophosphate, both of which are salts or esters of pyrophosphoric acid. These compounds are found in toothpaste marketed as antibacterials and in many types of mouthwash. Sodium phytate is a natural component found in plant seeds. It has been shown to reduce the accumulation of tooth stains and reduce the formation of dental calculus. In a recent study, scientists conducted a randomized clinical trial to test the effectiveness of toothpaste containing 0.5 to 10% sodium pyrophosphate. They found that the ingredients reduced stains by as much as 85% on average. For the purpose of teeth whitening, these toothpaste can help people achieve whiter teeth. These products can also be used to protect dental prostheses from staining. In addition to reducing tooth stains, toothpaste containing phosphoric acid also improve cleaning and whitening. These toothpaste can reach areas that toothbrush bristles cannot clean. A few studies, however, have shown that toothpaste containing sodium phytate significantly reduce the intensity of the stain. This may explain why these products have gained popularity among consumers. And, since toothpaste with this ingredient are so effective at removing stains, their popularity remains high. Baking soda. If you have stained teeth, you may be wondering if you can use baking soda for safe teeth whitening. Yes, it is safe to use, as it has abrasive properties that remove the surface stains on your teeth. It is a good alternative to whitening toothpaste, but you must be aware of the potential risks associated with the product. This video aims to provide you with the necessary information you need to safely use baking soda for teeth whitening. First of all, you should avoid excessive use of baking soda. Too much use can damage the enamel, increasing tooth sensitivity and possibly leading to cavities. Furthermore, the abrasive properties of baking soda mean that it must be used carefully to prevent damage to your teeth's enamel. Generally, it's recommended to use baking soda only once per week and for 2 minutes at a time. However, if you're worried about damaging your enamel, you should consult your dentist. While baking soda may be effective for whitening your teeth, you should be aware of its risk of removing your enamel. Although the ingredients are mildly abrasive, prolonged exposure can lead to erosion. To prevent this, you should always rinse your mouth with water after brushing with baking soda. For best results, you should use baking soda for teeth whitening every other day for a week or 2. But, remember to follow the instructions carefully. If you don't have time to practice this method, you should skip it until you have had time to use it on a daily basis. Thanks for watching. Please like, comment, and subscribe.